Welcome to We're on ECMO, a educational series for the ECMO community. My special guest today is Erica Colclough. She is a physical therapist and board certified cardiovascular and pulmonary specialist, owner of PT Core Competency, and Erica has been partnering with ECMO Advantage for the past few years in our ECMO Collaborative Care and Mobilization Simulation course. Thanks for joining us today, Erica.
Thank you so much for having me.
So I'm just going to jump right into it with some questions about mobilizing ECMO patients and early mobility. Obviously, this is a specialty of yours, and I know that there are a lot of places out there who are engaging in this more often or interested in this topic, and we would love to see that expanded because we know that there are so many patients who are benefiting from early mobility and ECMO patients particularly. And so I just want to jump in with the first question. What are some of the barriers, perceived or actual, that you have faced in your experience with mobilizing ECMO patients?
Well, a super fantastic question. The top three that I can think of, the first being the perception, the very real perception that these patients are too sick for mobilization. So clinically, you have a patient who has their heart and or lung outside of their body, receiving maximal medical support, and then it's like, okay, let's stress them and get them up and move them around, right?
Right.
But again, a perceived barrier. There's a kind of a level of clinical stability you're looking for participation, right? And grading activity tolerance to mobilization, right? It's not box squat and burpee day, right? I tell that to the physicians all the time. It's not box squat and burpee. Like, it's slow, progressive, functional mobilization that these patients can participate in safely when optimized. And I find that it's the interdisciplinary communication between therapy, the medical team, that makes that safe. So that's the first one, the perceived barrier of these patients are just too sick to move. The second being sedation. All too often, I think still in the ICU setting, sedation is used hand in hand sometimes with the management of these patients who are supported on ECMO, and the thought that these patients are, again, just too sick to wake up and participate. But what we're finding is if you wake these patients up, and again, I say to nurses all the time, weaning sedation sometimes is not sedation off. All we're asking is to wean the sedation to the point that the patient can wake up and actively participate. We're not saying all the time, take the sedation completely off. Again, wean it so the patient can wake up and be participatory if possible.
Right.
And then the last being communication. I touched on that in the first one, but interdisciplinary communication is super important for the safe management of these patients. Sometimes you find silos in healthcare where this team isn't talking to this team isn't talking to this team. But when you have super effective interdisciplinary communication and each kind of healthcare member can put what's going on with the patient in their own kind of language, in their own framework, so that we can all effectively manage the patient, that's where you're going to see the maximal benefit to mobilization and the actual management of these patients.
Absolutely. That's a great answer. And I know that there are just, a lot of those fears are real and justified. And a lot of it comes with that education and learning and the team effort, like this, interdisciplinary effort. And so that's super important. Thank you for sharing that. Kind of like one of those concerns, I think sometimes it's just like, hey, there's all these tubes and there's all these things coming out of these people, like, is it safe to mobilize femoral cannulated ECMO patients, both VV or VA, like, is it safe?
Is it safe? So it can be done safely. That's what the evidence and the research has shown. Both VA and VV patients supported on VA and VV ECMO can be mobilized safely with a femoral cannulation strategy. The key, again, as you said, Neil, the key is going to be education, education, education. Understanding what you're looking for contraindications to mobilization with femorally cannulated ECMO patients. Understanding what you're looking for to kind of assess tolerance to mobilization with the femoral cannulation. And again, effective communication amongst the team. I can't say that enough. Effective communication amongst the team so that everybody understands what the potential pitfalls could be relative to mobilization with patients who are supported with a femoral cannulation strategy, so that you can hopefully avoid those before you get to the issue. Or if the issue arises, this is how we're going to manage it safely, but before it becomes a bigger issue in the overall management of the patient's care. But yes, evidence says it can be done safely, but with a caveat, with a educated, interdisciplinary team. Absolutely.
Okay. So who are some of those patients that might not be good candidates that are on ECMO, but they might not be good candidates for mobilization, and why?
Okay. That's a good, again, fantastic question. So are you asking just femoral cannulation or just overall
Just
ECMO?
overall ECMO patient, like is there something particular about a patient that's on ECMO that you would say, well, they're not a good candidate? Maybe it's timing, maybe, is it maybe it's condition or whatever? What would you say there?
So sometimes patients who are not awake, right? We can't wake them up because they're hemodynamically unstable, because they're consuming too much oxygen and can't be adequately supported, are not candidates for active participation with therapy. But then there's other modalities that we could potentially utilize, verticalization, that they may be able to benefit from. Patients who are have a cannulation strategy that you've tried mobilization, and for whatever reason, they can't hold flows, can't hold adequate support. Those are going to be patients that we are kind of tiptoe around the periphery of mobilizing. But again, mobilization may not be what we try with those patients, but are there other interventions that we can try from a therapy standpoint to keep the patient kind of maximized for a hopefully eventual decannulation? Absolutely. But awake is usually one of the barriers to participation in mobilization, and inability to hold adequate support with mobilization are going to be the two primary issues. Yeah.
Absolutely. For teams considering mobilizing ECMO patients that don't have any experience and they're wanting to start, moving in that direction, what would you suggest?
I always say in the course, I always say it is an interdisciplinary sport, ECMO mobilization.
Mhm.
Interdisciplinary undertaking. So I would first start with a team meeting with all stakeholders at the table. So the medical team, the ECMO team, bedside nursing, respiratory therapy, rehab services, everybody sitting at the table talking about what mobilization looks like from their perspective, right? And what the expectations are, so that there's adequate planning relative to education, staffing, and how we're going to kind of execute this in a safe way, so that all stakeholders are at the table hearing the same thing at the same time and can put the plan in kind of their wheelhouse, their framework, so that it is a very comprehensive plan for mobilization of the patient, safe mobilization of the patient.
Yeah, absolutely. Yeah, I think, we could sum up your conversation in communication and teamwork. I think
Yes.
yeah, I mean, and that it is common sense, but it's hard to get there, I know, and getting everybody on the same playing field can be tough sometimes, but like you've mentioned as well, I mean, the evidence continues to show that this is beneficial for patients. And so it is encouraging to see it happening in more ICUs and among more ECMO programs. And we definitely, appreciate the work that you do with ECMO Advantage and helping to equip PT and OT and nurses and RTs be able to do that for ECMO patients. And one of the key things is that we talk about a lot here is this idea of not just seeing patients survive, but thrive. And I think that's definitely where, the full was it ABCDEF bundle, and early mobilization and mobilizing ECMO patients, it comes in that full thing, seeing it, these patients do well outside the hospital afterwards. And we really want to strive to help people and equip people to do that. So thank you so much for sharing your experience with us today. If you're watching today and you have a question that you would like to see answered by an expert, please email me, Neil, Neil, at ecmoadvantage.com. We'll see you next time.